So Dr. Irwin's the Director of Psychiatry and Psychosocial Services, which involves patient and family support services here at the Cancer Center at UCSD. He's also involved in the psychiatric care and the Director of the Palliative Psychiatric Services at the university. He's a Bachelor of Science in Psychobiology from UCLA, a PhD in Neuroscience from the University of Illinois, Urbana-Champaign. In 2006, he completed the psychiatry residency at UC San Diego and is Chief Resident of Outpatient Psychiatry Services, 2 years active in hospice and palliative care. And so he's going to talk to us about some of the services that are offered and some tips in terms of dealing with it. Thanks.
Thank you all for being here. Thank you for having me and that wonderful introduction. So just talk a little bit about patient and family support services in general. A lot of the facets of this are available at many major cancer centers, and then also a little bit about how we approach it here at UC San Diego. So one thing, and I think it was just highlighted actually by last speaker, is the impact of illness. You know, we're going along on a normal path of life. We have anticipated future, and illness brings an unpredictable future. And how many of you like sudden, unpredictable change? Nobody? There's no thrill seekers here? And most of us don't. And I think that was just highlighted. Really, that's what illness does to folks, especially in illness like CRC. So, and the issue is that, well, let me skip over that. That's for a different talk. So what people want, they want to live life to the fullest. They want us to fix the disease when we can. And when we can't, they want us to relieve suffering so that they can carry on with their lives, with the future that they saw, the things that bring them joy. 90% believe family responsibility to provide the care. And if it comes to the point where you're going to die, most people want to die at home, not in a lovely place like this or our new Jacob's Tower. They want to be at home. So this is our opportunity for modern healthcare. It's to bring people, put them back on that normal path of life. So we might not get back on the same path, but we want to offer them a predictable future, something where there's not all these sudden unpredictable changes, because that leads to anxiety. So I want you all to think about what you would want your illness experience to be, or what you want it to be for your loved ones. That's what we need to achieve. So a little bit about the services that we have here, and then interweaving sort of what patients and caregivers want. So our vision is setting the gold standard for whole person, patient, family-centered well-being in cancer care. And we want to strengthen meaning, value, dignity, quality of life, relieve emotional suffering through commitment to outstanding patient and family experience, excellence in patient and family care. And notice that we keep saying patient and family. Patient and family is the unit of care. The caregiver's not doing well, the patient's not going to do well, and vice versa, actually, as well. Sustained community engagement, I think that's what we're doing here today. Inspired teaching, we are an academic organization, and also groundbreaking research to bring not only the cures and the treatments, but also all of the other things that need to be brought to bear for outstanding cancer care and other care. So how do we approach it? Well, we provide specialized expertise for patients and families. All of my providers have expertise in cancer care or other advanced illnesses. We're not general psychiatrists or psychologists. We work as part of the rest of the cancer care team. So we want to be integrated and try to be integrated with the CLL team, with the other cancer care teams. So it's not, oh, go see patient and family support services over in that building across campus. That we are part of the whole team to help provide integrated whole person, patient and family-centered care. So one of the things we need to do is appreciate patient concerns. And when you ask patients that are facing serious illnesses, what are you most concerned about? They say loss of autonomy, less participation in enjoyable activities, loss of dignity, and we'll come back to that word dignity, losing control of bodily functions, being a burden on others, and concern of inadequate pain control. How much of this resonates with you? Does that sound about right? Yeah. Okay. What I like to point out to my colleagues is the things that patients are most concerned about when facing something like CLL or something else, it's not a lot of physical stuff. There is inadequate pain control and bodily functions, but the other four are all psychosocial in nature, right? This is what people are most concerned about. So dignity, what does dignity mean? It means worthiness, worthy, proper fitting. People want to be treated and cared for in a dignified manner that's befitting themselves, that's worthy of themselves. And how can I know what you find worthy and fitting for your faith? I have to ask, is it going to be the same for you as it is for you? No. I need to ask you what you find to be dignified care, so that I can provide, again, that patient-centered, patient-family-centered care. So if you ask patients what would impact your sense of dignity, and these are patients with advanced cancer, all cancers, they say not being treated with respect or concern, feeling like a burden, feeling lack of control, feeling like life was meaningless or I left no lasting impression, bodily functions, and not feeling worthwhile or valued. So only one of these is physical in nature that impact people's dignity. So if we're going to give people dignified care, we need to ask them what that means and what means to them. But most people list these things. And again, let me ask you, for who does this resonate with, as far as how they want to receive care or their loved ones receive care? So we need to provide whole person and family care. And we need to do this in all domains of care. So how are we going to care for your CLL? How are we going to care for the infections, the pain, the nausea? How are we going to deal with the fear, the anxiety, depression that comes? How are we going to help support you socially and maintain your social contacts? Friends, family, work? What about spiritual issues? How do they play into this for you? Be it religious or non-religious based spiritual issues? What about practical issues? We just heard our caregiver. How am I going to care for my young kids? How am I going to pay for this? Where are we going to do this? How am I going to keep my job? And if it comes to end of life, then how is that going to be managed and where? And am I going to be alone or in pain? Or is somebody going to be there with me? And then loss and grief, and we have to remember it's not just the loss and grief for the family, but also for the person who's losing their potential future. We just heard, even when you go into remission for a long time, that path of life is different, and you've lost that future you had in mind. That involves loss and grief. We need to be mindful of that and take care of that. And of course, this is a complex web. But what I like to point out is, again, most of these domains are psychosocial in nature. And when you do the psychosocial stuff correctly, the physical stuff goes better. If you get your psychosocial things addressed, your cancer prognosis is better, your ability to engage in treatment is better, your physical symptoms are easier to control. We need to provide whole person care and address all facets of what are important to people. So this is the team we have. We currently have 4 psychiatrists, 4 psychologists, hypnotherapists who I love on the inpatient unit, anxiety, relaxation, pain control. We take training very seriously and have psychiatry and psychology trainings. We get visiting scholars from all over the world and have administrative support and volunteers. We also work very closely with our social work colleagues as well. So again, we provide psychiatric services for assessment, treatment, and medication management. We are able to add inpatient services, which we didn't have before, and we have outpatient services here at the Cancer Center. Same thing for psychology, assessment, diagnosis, testing, and individual couples, family, or group psychotherapy. And we heard how important talk therapy was for the caregivers. Excuse me, it's my second talk of the day. We are able to do this inpatient and outpatient as well. And then, as I mentioned, a shared vision and mission in close collaboration with our social work team, who focuses on emotional support, communication, facilitation, connections with community resource, and cancer experience information. So I mentioned hypnotherapy. We have therapeutic groups focused on specific things like insomnia. We now have a grief and bereavement group, and we're also about to start a mindfulness group. We have general support groups, caregiver support, and cancer support. We have workshops and classes like yoga, expressive arts, writing through cancer, couples workshops, and mindfulness meditation. We also just did a couples massage workshop that went over very well. Often caregivers are like, how can I help my loved one? I'm not sure what to do. And giving them a way to do therapeutic massage or interact with their loved one in a different way that provides comfort and intimacy is very helpful. So very popular. We hope to repeat that. That was from a generous donor. We were able to provide that. And I'll skip over these. So what's our impact? Well, I hope it's improving quality of life. That's my number one goal for patients and families. Strengthening meaning, value, and dignity, relieving emotional suffering, improving prognosis and outcomes, and improving team satisfaction and morale. Sometimes patients and families or caregivers can be challenging or a challenge, and the oncology team needs some extra help, and we can help with that. Or sometimes symptoms are not responding the way they would expect, and there might be a psychiatric or psychological issue that's getting in the way. Pain's not getting better. Why is that? Well, it's because the anxiety is getting in the way, so we can help with that as well. So these are some of our future goals. We want to grow with the health system and the cancer center. We want to continue to integrate with the care teams in a much more seamless way and really subspecialize in services. One cancer is not the same as another cancer, is not the same as another cancer. So I want my staff to be able to specialize so that the CLL team is working with the same folks in my department all the time. It builds rapport, it builds trust, and they get to know the patient's special needs and issues that are specific to that kind of cancer. And of course, we all need more space. We want to increase the variety of our supportive offerings. We've heard about people want some Tai Chi, gentle Zumba, all sorts of things that we can add that we're hoping to add as well. I'm not sure I can do gentle Zumba, but we'll have our patients and our families do that. And we do have a commitment here to providing unfunded care. So we take care of my program, all comers, regardless of ability to pay. Expanding our training opportunities, more research, raise internal and external awareness, and grow our philanthropic support. So one of my favorite quotes, and somebody who's overcome more suffering than probably most of us, Helen Keller, although the world is full of suffering, it's also full of the overcoming of it. Strengthening meaning, value, and dignity is what I think we're all doing. Oncology, psychiatry, psychology, all together. This is our goal. And we do this through transdisciplinary care. So coming together, we are better than the sum of our parts. So with that, if there's time, I'm happy to answer questions, or we need to move on. We can move on.
I think we'll do the questions at the end.
At the panel?
Yeah.
That's fine. Thank you all for your time.